allow us to introduce our little Integrative Therapies team. We are part of the patient support and education team at Frauenshuh Cancer Center in Methodist Hospital. And starting on the left, we have Julia Cook, who is not with us today, but Julia has been doing massage therapy for 25 years, and she's been with the Integrative Therapies team since 2017, working with oncology patients at Frauenshuh Cancer Center, Maple Grove Infusion, and Methodist Hospital on a part-time basis. And additionally, Julia specializes in sports massage, and she's a massage therapist for the Minnesota Timberwolves, Minnesota United, and the Lynx. So she is our resident rock star. In the middle here is me. I'm Lisa Leonard, and I joined the Integrative Therapies team in early 2022 as we were building the from a pandemic pause. I have a master's degree in counseling psychology and a background in health journalism. And in my capacity at Frauenshuh and Methodist, I provide massage therapy, healing touch, and compassionate presence for patients, family members, and employees on a part-time basis. And I will let my wonderful colleague Carmela introduce herself.
Thank you. Good morning, everyone. I'm Carmela Nyemetz, a nurse of over 25 years with a background in acute care, urgent care, and nursing leadership. I am a certified healing touch and M technique practitioner and a Reiki practitioner. And I work part-time at the Methodist Hospital on the 5th floor oncology unit as a registered nurse, integrative health practitioner, and in a casual position at the Frauenshuh Cancer Center as a healing touch practitioner. And in these roles, I use my nursing and holistic practice and assessment skills and therapeutic presence to provide that whole person care to support our patients, families, and caregivers. So here's a rundown of the agenda for today's presentation. We will be talking about what are integrative therapies, who we serve, what we do, the integrative therapies that we offer. We'll discuss benefits of integrative therapies and how we're removing barriers to the access. And then we'll talk about some opportunities for the future and look forward to taking any questions. But before we go any further, we'd like to acknowledge that as we talk today about providing integrative therapies to patients and families navigating cancer diagnosis and treatment, this could hit close to home for many on the call. So many of us have our own lived experience with cancer, or maybe we've lost someone to cancer, or are caring for and supporting someone who had or has cancer. So these conversations can stir up many feelings and emotions, and we recognize the emotional weight of the conversation. So please do what you need to do to take care of yourself during the presentation, and know that our intention is to walk gently here. So with that said, we'd like to take a little integrative therapies moment to ground and just center ourselves. So here you see in front of you a beautiful picture of my own motherland, New Zealand. A calming nature scene here that you may appreciate. And of course, research has shown that being in nature and even looking at pictures of nature can have healing benefits. So we just invite you to go ahead right now and just really get comfortable, take a nice deep breath, maybe bring your awareness or feel your feet on the floor, maybe place a hand on your heart, and feel the gratitude that we're sending from our hearts to yours for your support, your time, your curiosity to learn more about the work that we do. And we hope that you have a warm cup of coffee and tea handy too. And know that your presence here matters and you matter. As we continue in that spirit of gratitude, we would like to call out the people who we partner and collaborate with to make this work possible. So a special thanks to the Park Nicollet Foundation and donors who provide funding and support for the Integrative Therapies program and events, and for Employee Health for sponsoring events and offering us program support and guidance. We'd also like to recognize and celebrate all the volunteers that may be on the call today and those watching in the future. We were lucky to have volunteers from the hospital and community helping us at our recent integrative therapy events. You bring such enthusiasm and heart to the work, and we thank you for all that you do. On the slide here, you'll see other trusted partners and champions of integrative therapies named here, and they are essential to help us deliver the care and ensure our success.
Indeed. So, what are integrative therapies? We know the term can mean different things to different people, so let's just define what we'll be talking about today. In a broad sense, integrative therapies are an integration of conventional and so-called alternative medicine, of modern medicine and traditional practices, of evidence-based care and intuition. It means caring for someone as a whole person rather than merely treating a symptom. It's based on the premise that the body knows how to heal when conditions are optimal. And so we try to help patients get closer to those optimal conditions. And we strive to create a healing environment for our patients, and we consider ourselves part of that healing environment. So, of course, there are many different kinds of integrative therapies, and we'll focus today on the several modalities that we provide in our roles, the people we're reaching with those therapies, and the environments where we provide the care.
Yeah, thanks, Lisa. So we serve patients and caregivers in a variety of places and locations within these settings. So for our patients, we serve patients at Methodist Hospital on the 5th floor and patient rooms at the Frauenshuh Cancer Center in the dedicated integrative therapy treatment rooms, in infusion rooms, and occasionally even through virtual visits. And as Lisa mentioned previously, Julia provides massage therapy at the Maple Grove Infusion Center. And we also provide care for team members. So our team member care has consisted of larger, centrally located events at Methodist, and most recently at 3 ambulatory clinics. We provide one-to-one sessions on care units in the hospital, and when additional support is needed or a team member is just having a tough day.
So, in addition to providing direct care, our team plans and produces integrative therapies events. We engage in program development and we collect data so we can measure and understand the impact of our work. And just as we use an integrative approach in our care, we want to understand the holistic picture of its effects. So, we look at both quantitative and qualitative data. At Frauenshuh and at Methodist Hospital, we offer a number of integrative modalities, including massage, healing touch, M technique, and aromatherapy. Some of these may already be familiar to you and some may not, and we'll look at each one a little bit more closely. And each session also usually involves some guided relaxation and breath work as well. All of these therapies, of course, are tailored for patients living with cancer, those with chronic illness, and those who may be medically frail. And they're offered free of charge, thanks to the support of Park Nicollet Foundation. Patients at Frauenshuh have one complimentary 30-minute session of massage or healing touch per month, and that's ongoing through their treatment and for 13 months afterward. Patients are really grateful to receive that care, and we are honored and grateful to be offering it. With massage, healing touch, and M technique in particular, what we're really doing in a sense is bringing touch back into healthcare. Touch used to be the standard of care in nursing, but as healthcare has become more complex and technological and more fast-paced, much of that connection gets lost. But we know from research and from our own observations how helpful touch therapies can be in supporting healing and a sense of well-being. These practices, of course, also have a long history with roots in traditional hands-on healing across many cultures. Depending on what's going on for patients on any given day, massage might be for relaxation and stress relief, or to address tight spots, or to counteract side effects from surgery and treatment. A lot of our patients have some level of neuropathy, so they may have trouble feeling the ground underneath them when they try to walk, or they may have trouble holding on to things because their fingers are numb. And of course, that can really impact activities of daily living and quality of life. Or people might be sore from holding an uncomfortable position for a long time during their scans. And so massage can help with those symptoms. And massage, along with our other therapies, can also offer much needed emotional support because it's soothing and it's comforting. We adjust pressure and we modify our techniques as needed, of course, based on patient's condition. So what's termed massage might involve moderate pressure and kneading of muscles, as you would traditionally think of for massage, or it may involve very gentle comfort touch or gentle holds. And healing touch is an evidence-based energy therapy that uses light touch to support overall health and well-being. It's grounded in the same principles as Asian healing traditions like acupuncture and qigong, and it's based on the same concept of universal life energy and the need to maintain flow of that energy for health of body, mind, and spirit. So healing touch is really right at home in an integrative care model because its goal is to support the body's own natural self-healing process. And because it's so gentle, it can be used with patients experiencing a range of conditions, including at end of life. And patients can even use it for their own self-care. A holistic nurse named Janet Menken, who is pictured in the top photo there, saw the benefit of energy therapies for people in healthcare and in hospice settings, and she developed an accredited program of training that's endorsed by both the American and Canadian Holistic Nurses Associations. Carmela and I have both completed that training, and we are certified practitioners. And Carmela will share a little bit more about M technique and aromatherapy.
Dr. Jane Buckle, a British RN and a massage therapist, created M technique as a means of holistic communication and initially developed this technique when she was working with critically ill premature babies. So M technique is a manual structured touch technique for medically frail, critically ill patients. It uses simple sequences of touch repeated a set number of times at a set pace and at a set pressure. And it has this wonderful sort of hypnotic effect. It's performed on hands or feet, or there's a full body technique that you can do. And so again, it's a means of holistic communication and offering nurturing, comforting touch. So very good when it's used when massage may not be appropriate or for those not trained in massage. So even caregivers can train in this to connect with their loved ones and offer care. Aromatherapy is a non-pharmacological, non-invasive approach to managing pain, nausea, stress, anxiety, and insomnia, among other symptoms. And in our setting, we administer aromatherapy by using an adhesive patch infused with an essential oil. So here we show on the screen lavender, mandarin orange, and spearmint. And these are used by the care teams in the hospital and the clinic setting and to complement our touch therapies. So this was a brief overview of the therapies we currently offer, but there is much more to integrative care than applying these techniques. So at Methodist and Park Nicollet, or at our events, no matter where we work, be it in an exam room, a hospital room, or infusion room, or a conference room, or even a hallway, we're focused on creating a healing environment. So this, of course, often calls for creativity, but imagine being in a clinic or a hospital room with many distractions, constant disruptions, unfamiliar faces, and unpleasant noises and smells. So patients often also experience a high degree of loss of personal control of their space and their time in these environments. And not only that, they're dealing with illness in the context of a broader and broken healthcare system in our country that causes increased stress. So we routinely witness patients laying in their hospital bed, worrying about finances, living situations, their job, and impacts on their family and future, while grappling with their own health crisis and sense of mortality. So because of this, we are very intentional about considering the following when we're making these environments more conducive to healing. So when we come into a room, we move slowly and intentionally and approach the patient, asking permission to even be there, introducing ourselves, setting and building that trust. So we minimize disruptions and noises. So We advocate for patients. I put signage up on the door when I do a session in hopes that people see it and will take some time to respect that that patient just needs that time to have a session without disruption. The immediate environment. So when we come in as integrative therapists, we're assessing the environment for, does it feel chaotic? Is it cluttered? Is there something that I can do that would be meaningful for the patient? Sometimes for me, and patients have expressed appreciation, it's just cleaning their tray table. It's removing all of the medical supplies off the tray table and just having it for their own personal items. So it's their space that they control. And of course, we bring our caring and compassionate presence, building that trust with the patient. And once a session starts, the environment, we dim the lighting, we'll bring music in and use guided relaxation as we start the session. We may remove unpleasant scents, or we add scents that are pleasant, or aromatherapy. And of course, we're always taking that whole person approach. So we're considering their physical needs, emotional, mental, spiritual state, and supporting them.
Hmm. And as a part of our whole person approach, of course, we're tending to the body. These are some of the symptoms that integrative therapies have been shown to improve. So, in terms of collecting data, these are some of the things that we can measure when it comes to the effects that we're having on the symptoms that patients are reporting, which may be due to their cancer or to their cancer treatment or to other chronic conditions they may have. And of course, there's much more that's happening when we're talking about whole person healing.
Yes, so while we can collect data and more easily on those physical symptoms and feedback, there are many other benefits that are more difficult to quantify, but they can be equally impactful, if not more so. We're helping people remember what it feels like to be in their body in a more peaceful and present state, feeling grounded and centered. And when in this state, people are more able to begin to integrate their diagnosis and their treatment experience. And as practitioners, we get to acknowledge, validate, and normalize their experience and their emotions. So we listen deeply. And to help the peaceful effects last, not just while they're in their session or in a treatment room, but for them to feel empowered and in control as much as they can during a very chaotic and uncertain time, we empower them with practices they can use to care for themselves in the future, to come back to that sense of presence and calm. So we want to support their overall quality of life and improve their sense of well-being. And we often hear feedback about this from our patients. So I'd like to now share one example of a patient experience that I had. So when working at the Frauenshuh Cancer Center, I got a same-day referral from a nurse to see a patient receiving chemotherapy in an infusion room who was having a particularly tough day. They were experiencing high levels of anxiety and fear, anticipating the side effects from treatment. And when I entered the room, she was near the end of her treatment that day and was anxious to leave when I came in, understandably. But after introducing myself and informing the patient about integrative therapies available to her and offering care, she weighed the opportunity to leave versus receive care. And I was so grateful she decided to stay a little longer. I provided a healing touch session, and I observed her relaxing deeply with her eyes closed, her breath slowing, her face softening. And at the end of the session, she gently opened her eyes, and we looked at each other for the longest time without speaking as I held her hand. And there was this unknown, unspoken knowing that and acknowledgement that something important had just shifted within her. And here is what she said. I always saw coming in for treatment here as coming into a place of destruction. But after this session, I see the possibility of this being a place of healing. So I think this feedback is a great reminder of how the healthcare environment itself can be traumatic and induce a stress response, and how integrative therapies can offer a counterpoint to that. So it's personally such an honor to be with patients in this way and witness them gaining insights and finding some peace. Another patient shared, "This touch and energy truly allowed my body and mind to float away from the stress, tension, and pain I was going through being hospitalized. This type of healing should be available on every floor of every hospital in the United States."
And of course, we couldn't agree more.
Yes.
Just wonderful feedback and just such meaningful work, as you can hear. So, switching gears a bit, we're excited to share with you about a newer initiative to build on work that was happening in the organization to bring care to employees at Park Nicollet as well. In late 2022, 3 years into the pandemic, we were seeing a need to tend to our colleagues who are experiencing really high levels of stress and burnout. In 2023, with a grant from Park Nicollet Foundation and partnering with Employee Health Services, Carmela and I piloted a 4-day event to provide brief integrative therapy sessions for employees from across the Methodist campus. And we had live music therapy provided by our wonderful music therapy team. And so earlier we talked about the importance of creating healing environments. And in this case, we transformed an auditorium conference room into a healing oasis of calm. And over those 4 days of integrative therapies, we were able to provide 222 sessions. And to measure the effects that we were having, we offered a post-session survey, and we were really happy to see that we made a positive difference. So going into the event, not surprisingly, attendees were reporting a really high level of stress and tension with an average score of 7 out of 10. And so that's in the low end of the severe range of that scale. But after receiving care, they rated their stress and tension levels at an average of 3.5, which reflects a dramatic drop of 50% from just those 15-minute sessions. And in the first half of this year, again with foundation and employee health support, we repeated the event at Methodist and we took the show on the road to 3 Park Nicollet clinics in St. Louis Park, Burnsville, and Maple Grove. And again, our post-session surveys showed that we had reduced levels of stress and tension by half. And with those additional event offerings, we were able to provide 651 sessions. So here too, um, our colleagues are living with a lot of the same issues that our patients are. They have stress and tension. They may be experiencing chronic pain, or they may be living with other chronic conditions. They themselves may be living with cancer. So they receive similar benefits to patients from these therapies. And additionally, there are some workplace-related benefits. So we're helping to address and prevent burnout. We can help improve job satisfaction and staff retention. These therapies allow us to recognize and thank our team for their amazing work. And this helps them feel seen and appreciated, and that boosts morale. And the fact that employees are receiving these therapies firsthand not only is offering them that much needed care in the moment, but it increases their knowledge of the therapies that are available to patients, and it increases their comfort level talking about the therapies with patients. So it's really helping to expand a culture of integrative whole person care in the system. And similarly, with our employee testimonials, the comments we get speak to how impactful even a brief session can be. So the first person was saying, "This was absolutely wonderful. My practitioner's words and presence brought tears to my eyes. She could not have been more welcoming or calming. She told me that I was necessary and valued, and this resonated in my mind for the rest of the day. Thank you for providing this service. It was a powerful day maker for me." And I really appreciated this. I was having a tough morning and was experiencing a lot of anxiety. I now feel able to make it through the rest of my day and be productive.
So those are some really gratifying outcomes, both quantitative and qualitative. And now if we pivot sort of and look at from a business perspective, how do integrative therapies help a healthcare organization? Well, happily, we see a lot of alignment between integrative therapies and the goals of the organization. More and more people are understanding the benefits of integrative care and seeking it out. So we're addressing consumer demand. Integrative therapies have been shown to improve patient outcome and experience, and this may be seen in increased HCAP scores for patient satisfaction. We're meeting and improving on industry standards. So, for example, as of January 1st, 2018, the Joint Commission requires accredited hospitals to offer integrative therapies for pain management. And for those who may not be familiar, the Joint Commission is an independent nonprofit organization that certifies healthcare organizations in the US, and it's a mark of quality in healthcare. And research shows that integrative care helps reduce length of hospital stay, which is another important consideration for the organization.
Mhm. And so, in a whole person, whole systems approach, we want to be mindful of who has access to this care and who doesn't. There are a number of ways that our model is already removing some barriers for people. For instance, because our services are no cost and they're offered where patients are already receiving their care and at healthcare workers' own workplace, we're circumventing some barriers associated with transportation and with financial limitations. And we know that many of our recipients, whether patients or healthcare workers, are learning about and experiencing these therapies for the first time. So we know that we're increasing access in that way. People with cancer often face barriers to accessing massage in the community because they're often referred away by providers who aren't familiar with cancer care or don't have training in cancer care. But of course, here, these patients are welcomed and they can trust that they're receiving safe and appropriate care from providers who understand their needs. And our treatment rooms are accessible for people with varying levels of ability and mobility. We have hydraulic tables that can be raised and lowered and configured to support people in a variety of conditions. We also have language interpreter services for our non-English speaking patients. And in terms of barriers for staff, we learned a lot from our employee events. We know that we have to keep sessions brief because it's difficult for folks to get away from their busy departments. And we have had some success pivoting to bring care directly to their departments and care units so they can more easily get away and receive some care. And interestingly, we also found that a disproportionately low number of clinicians, so MDs, nurse practitioners, physician assistants, attended the wellness events. And we know that their days often don't include time for lunch, much less stepping away for a brief session of massage. And their schedules might be booked out for months in advance. So we're hoping to better understand their level of interest in participating and then seeing how we might be able to make that care more accessible for them as well.
So there was a lot of information in a short amount of time, but we have a bold vision and a lot of passion for expanding this work. So just appreciate some time to talk about opportunities that we have identified. So much of what we've described here has been accomplished with 3 part-time employees. So in order to reach more patients and team members, there are a number of ways to achieve this. Of course, increasing integrative therapist hours. So the demand for services outweighs the human and financial resources we currently have. Expanding training for team members. So people already on staff can offer the care and bring the integrative mindset. We can also potentially provide training on specific modalities. And then shifting that model of care delivery. So as Lisa had mentioned, just moving toward and bringing the care to the people versus expecting them to come to us.
Mm-hmm. And we see an opportunity as well to continue to improve continuity of care across inpatient and outpatient settings. So those environments have traditionally been somewhat siloed. And as we've been working to build relationships across those environments, we have found some opportunities to provide a more seamless experience of care for our patients. And then data collection. So just as we're sort of reaching across that divide of inpatient and outpatient care, we've discovered some differences in documentation tools and workflows, for example. So to improve the quality of the data that we can collect, we're working to standardize how we collect it and improve our reporting across the inpatient and outpatient settings. So that'll help us better evaluate what we're doing and be really mindful and strategic about our next steps.
So again, a lot of information in a short amount of time. We're just incredibly grateful to have been able to present information about integrative therapies in these environments and locations. And I think we're ready to either take some questions or put it back to Abby here if we need to.
Yes, ladies, thank you so very much for an excellent presentation. The work that you do is monumental, and I loved hearing personally about like the holistic benefits, both from a mental health perspective and a physical health perspective, with the work that you do. And the testimonials were incredible. I think they said so much about the benefits that you guys provide. I do have a couple of questions, if you don't mind, that right off the bat that I can ask. And then for those on the call, you can enter in any questions that you have in the chat or the Q&A, and I'm happy to read those off as well. So the first question I have is, you had talked about how you create a healing environment for patients during and outside of sessions. Do you work with care teams to share how they can implement these same practices when possible to maintain this healing environment even when you are not present?
Yes, I think, when there's an organic opportunity in the moment, we can speak to that. If somebody is nearby, we can just mention that, hey, I noticed that this was happening, and so I did this, to sort of model that perspective when entering a room. And I think that's some of the training that we would love to work on in the future too, around just bringing that whole person holistic mindset and really being aware of the energy that we're bringing when we enter into a patient's space.
Yeah, and I have an example to add to that. So as in my role as the integrative health practitioner on the 5th floor, I present at the oncology symposiums for the staff every year and get to meet with new staff occasionally. And in that setting, and just ad hoc on the unit, I often get to share mindfulness-based techniques with the staff. So one that we just covered at the local most recent symposium was leading them through a grounding exercise and doing it in a very quick moment by moment way, even before they just go into a room and they're foaming in and foaming out, and just setting them up with this intention to sort of, as they're foaming in, foaming out, breathe in, breathe out, ground, leave everything behind as you enter into this patient room. So yes, there are definitely lots of things that we can offer for our staff to take with them that translates for the patient experience as well, and their own experience as they move through their hectic and chaotic day.
Mm-hmm.
Thank you. That's awesome. Another question that I have is there an opportunity to provide integrative therapy for overnight staff?
Yes, we have been trialing some evening sessions with mixed results. I think, we face some of the difficulties still of people getting away from their departments. And there are sometimes staffing issues on the part of the team as well, with other daytime commitments.
Yes, but
Carmela, would you like to speak to that as well?
No, and I think it is important to make sure that there is sort of coverage across all the shifts, especially in a 24/7 environment, right, where we're providing care. So I have done shifts from 9 p.m. to 1 a.m. To get the to get the evening and the night team some care on the table. But I think Lisa spoke to the difficulty sometimes of getting off the floor.
Thank you. And then a question that I had is one of the things that I loved that you guys presented about is that when you are providing these therapy sessions to patients and everything like that, you do help them learn, like you had said, to adopt those kinds of practices or ways of feeling better in the future. What kind of approach do you take, or what kind of resources do you provide to patients so that they are able to mimic those, as much as they can, those therapeutic effects from the treatments that you're providing for them?
So just as Carmela was sharing about some of the things that she's been working on with employees, we can use some deceptively simple tools with patients as well. Sometimes as simple as putting hands over the heart, that even that touch of one's own hands on the heart is known to be calming and relaxing and centering. It's a way of caring for oneself in a stressful moment. Something like taking 3 deep breaths. We also have a self-massage guide that a previous massage therapist produced. So we've had a lot of patients asking, how can I do this at home? Like my spouse is willing to help me with this. How do we do it? Where do we start? And so we can offer them that guide as well. And then with the guided relaxation, people are having some experiential learning in the course of a session. And Carmela may have other examples she'd like to share.
Yeah, and sometimes it's just reminding them, depending on, their technological prowess here, how they can handle technology. But, there's so much out there, even on YouTube or in free sites for doing guided meditation. Sometimes it's just reminding people to stop during a day and take a restorative rest position and lay down for even 10 minutes, put a guided meditation in. So there's many different resources that are very handy to hand them. Breath work, just a little handout or sheet on breath work that they can do, and they could do that at any time of the day. When they wake up in the middle of the night and their mind starts spinning, yes, just offering them those resources that are out there. But there's a lot on the internet and in different platforms, and to offer them.
Thank you. And this is an open-ended question, but just out of curiosity, what inspired you both to become integrative therapy practitioners?
Yeah, well, I can speak. I think I've practiced holistically in my nursing practice throughout my career, and I've seen the benefits, even working in cardiology, when I had a moment in time at the end of an evening shift to just go in and maybe even give a patient a foot rub. I had the experiences of seeing the benefit of touch. I had monitors all over the place, and I could see that the physiological effects after someone had cardiac surgery, when I touched their feet and or gave them a back rub, that their blood pressure came down, their heart rate came down. So there were, very there were physiological changes that I could see in the power of touch, and being present with people and listening deeply with people. And I had my own experience working in healthcare, just with my own burnout and learning how to take care of myself. So I had to practice what I preached, and have seen the benefits of that in building my own resilience and grounding and centering in my life. So it's personal, and it's also sort of what I've seen the power of it in others.
It's similar for me as well. I both a personal and professional interest in these therapies, and exploring in my background in psychology, human story, and spirituality, grief and loss, and so just appreciating what human presence can do in terms of healing, that relational healing experience. And going through my own experiences of grief and loss and of burnout at a previous job, these therapies became more personally meaningful. So, it's a matter not just of practicing this in our professions, but practicing them in our personal lives. So it's been really transformative in that way. And it's just an honor and a thrill to share it with people and to see those subtle but major shifts happen.
Yeah, and I think it's helping patients and understand the connection, the deep connection between mind and body and spirit, and living in alignment and, yeah, finding their center again.
Thank you both so much. Yeah, I was just curious because just the work that you do is so transformational. And I don't know. I mean, it takes a very special person and a very caring and passionate person to do the work that you do. So I just had to ask. But let me double check here for our Q&A box here. Lisa and Carmela, if anybody has any questions after the presentation, is it okay if I field them to you guys to get answered?
Absolutely.
Mm-hmm.
Okay.
Would love it.
Wonderful. Well, thank you for your time today, and thank you everybody who came and
Yes.
joined us on the call. And I hope everybody has a wonderful day. Thank you so much.
Yes. Thank you, everyone. Take good care.
Thank you. Bye now.
Bye.